I grew up in a medical family. My mother is a nurse. My father was an OBGYN, and I'm the oldest of four. I expected I was probably going to continue on the family lineage in some way, shape, or form. And I started working with my parents in Dad's office when I was 15. And I learned how to drive, driving him to deliveries. So I'm not the best driver. And yeah, it just always seemed natural. In about the third or fourth year of my surgical practice, I was practicing at a hospital that was going to become, and actually did become, the very first bariatric program in the state of Indiana. And I was the principal general surgeon. I had done some form of bariatric surgery in my surgical residency, but at the time, in the early 90s, nothing was being done in Indiana. And so when I was approached, initially I thought, geez, nothing's happening there. What do you mean you want me to do that? So I was flown to Davenport, Iowa, and looked at another program with surgeons who had been doing this for quite a long time, and went with the medical director of the nationwide program at the time. And I was very, very impressed at the fact that it was a real multidisciplinary, comprehensive. It wasn't just, hey, somebody wants to go do some surgery. And the results were good, the safety record was good. And so I started to really get interested in embracing that concept. So I think it was serendipity, maybe, and it was a good match. And I'm very fortunate to have been now doing that for about 17 or 18 years. Away from the office, I am a mother of three. I am a wife of another physician, and we try to figure out how to see each other. And I am a gardener. I try to figure out how to garden in gloves so that I can come in the next day, but it's a passion. I love animals, and I learn languages. So the Rosetta Stone people must love me because I've got 7 or 8 of their, different languages. And now I've gone on to a different brand of learning languages because it's just fun. What I enjoy is the human relationship, and I'm a little bit wistful about it because I see the beauty of the technology helping us to make diagnoses and treat things, but to me the essence of medicine is one human being helping and caring about another human being. And sometimes I really don't feel like sometimes in a cancer situation I may not be able to cure someone, to help to the fullest extent, but you can always help just by being another person there, just a caring, a touch, a hug, and it's more meaningful to patients than you would think. So I develop some really nice friendships, and I think it's important for me that my patients feel comfortable with me and hopefully have a trust, because that's what I expect when I go to a physician. If I don't get a good feel, I'm not going to have a good relationship with them. And I still think that even if it's hard to find, you ought to try to do that, because you deserve that. I think it's real important.